today I'd like to give you an overview of what we're doing in the modelling theme, specifically as regards small biomolecular crystals. So the message I always want to get across about modelling is that we're using our atomic scale lens in order to simulate macro scale behaviours and properties of pharmaceutical materials. We're highly quantitative in what we do, so we don't just tell you that a particular material performs better than another one. We can quantify the actual properties of what you're looking at. And what I'm showing you today in 10 minutes is very much a whistle-stop tour of the potential that modelling can have for modelling pharmaceutical formulations. So we're always looking to push ourselves in the boundaries of what these kinds of models can do. So the nice thing about modelling is that we're really embedded at the heart of the challenges that SSPC researchers are trying to overcome. I've started with the two that I think we're having a lot of current impact in, which firstly is reducing time to market. Modelling allows us to screen materials very quickly for certain properties, which allows us to cut out a lot of time in choosing candidates to work on. And also in terms of, as Mike pointed out earlier, crystal engineering, multi-component crystals, and going to build up today to the more and more complex materials that we can model. And that's what we're currently very good at, looking towards the more exciting things like personalized medicine and plenty of room at the bottom type concepts. So modelers can come in at any point in a research project. We love to come in at the very, very start in terms of screening, predicting, understanding materials, but it's also fun to come in at this kind of stage to troubleshoot certain problems or to rationalize, look towards design rules of why certain materials have certain properties and behaviors. But the key message again is just that modeling and experiment should always be working side by side, and that's really what we try to do. So the type of modelling that we use is called density functional theory. It's right down the bottom here in terms of the length and time scale that we use. And over the past 5 years, we've developed highly robust models for working with small molecular crystals. I used to say that our limitations were system size and computational effort, but we've had some great collaboration with Dr. Pierre Cassad and the Department of Physics that's really cutting out the limitation of system size. So we're really moving towards predicting the functional properties of larger and larger molecules using our methods, which is very exciting. So because we've been developing this over a long amount of time, and because experimentalists have to have a lot of trust in the modelling that we do, we've benchmarked our models across a wide variety of materials. This is a very small snapshot where we started with small inorganic molecules that are very amenable to these kinds of calculations, moving on to more biomaterials and then into pharma and into co-crystals in particular. Something that I love that we can do is instead of running all of your samples through a compression tester for a couple of days, we can actually now predict in silico stress strain curves. So we can predict both the linear and the non-linear response of pharmaceutical formulations, which is very exciting. But at the core of it, and again, we're going to start with the simplest API crystals and work up to more complex formulations. But the most helpful that we can be at the start of a research project is screening these small biomolecular crystals. And those can be simple questions like what makes a good pharmaceutical drug, what's its processability, its tabletability, and different processes like that. But really, we want to streamline both our time and resources and your time and resources when working with large sets of potential candidates. But the real fun, not only in just telling you what material is good and what material is bad, is actually using that information to design better materials and better drug products. So we can simply give you, the predicted properties of a material, but really what we want to do is break that down to the atomic scale and say what makes a material good, what makes a material bad. So we can look at highly anisotropic responses in different crystals, again relating it to bonding patterns within crystals and how that contributes to properties, and we can break it down in terms of very intricate unit cell and supramolecular packing behaviors that again give rise to the best drug products. So I'm going to give you a couple of case studies. The first is a paper that Damien mentioned this morning, the work of which was carried out by Rhea and the modelling theme. And it just really shows how intricate we can be when looking at drug products that we all use both day to day as people and as researchers. So this was a paper looking at different forms of aspirin and paracetamol, and again we can predict the tabletability, the mechanical properties of these materials to a very high accuracy, but also break it down in terms of the anisotropic response and the bonding patterns and atomic packing that give rise to the tabletability or processability of those crystals. We can also look at slightly crazier responses. Biomolecular crystals can do some pretty weird things sometimes. This is a particular case study of what are called photosalient crystals. Crystals, when they're exposed to UV light, they actually explode, they shatter into many pieces. But I wanted to show you this today because it shows that if you have a single crystal to single crystal transformation in any process or in any biomolecular crystal, we can track the functional properties and how they change once we have our single crystal input into our models. And also, again, just to highlight constantly that we're improving our predictability and our accuracy in comparing our models to techniques like nanoindentation, like compressibility testing, and things like that. So, going slightly more complex, we can then go from our single crystals to our multi-component forms. That can be a co-crystal, a salt, a ternary system, anything where you're combining different molecular recipes to form different types of drug products. And what we can do is we can look at how certain APIs and coformers pack together, and then how that relates to their functional properties, such as stiffness and compressibility, and again, go towards the design rules of what is it about these materials that makes them stronger or more flexible, and how can that inform how we manufacture these drug products. And finally, we can introduce even more ingredients into this process if we go to the molecular level. So we can introduce excipients, surfactants, other different molecules that are in the pharmaceutical processing workflow. So this is a case study from a couple of years ago where we were looking at THP, which is a respiratory drug, and using very simple molecular ideas, which is that if your excipient is binding either of these molecules too much at the start of a mechanochemistry process, you're not going to get very stable crystallization out of that. So from that study, it really let us know that we could start looking at more large-scale industrial processes, but bringing it down to this very simple molecular level and having very high predictability in how these molecules interact and how that contributes to the stabilization of drug products in mechanochemistry processes. And finally, this is another cool study out of SSPC. This was led by Ahmed and Constantina in NUIG. And they were looking at DOX loading, so a cancer drug, looking at loading it into these metal organic frameworks. And again, we could see all the possible configurations of how that drug interacted with the framework when it was loading. And we could match, again, using these very simple molecular interactions and calculating ground state energies, we could match the experimental measurement of the loading and unloading into this framework, which is very cool. So looking forward, what we're doing now in my group is really looking at scaling up all of these things, looking at very kind of things that were mentioned in the last session, high-throughput screening, in silico high-throughput screening, and also towards machine learning to design in silico the best possible drug formulations based on these kinds of molecular models. So we want to screen, we want to expand the size of the molecules, as I said, and then actually use this data, not only discovering materials, but using that data to design new materials as well. And again, looking forward, this is a project that we're going to be starting now, building on a work in Sarah Hudson's group. We're looking at, again, more and more complex systems where you have multiple excipients, multiple surfactants, and coformers, and everything in there together. Can we realistically model how those things interact at reasonable scales? Then, if we move out of density functional theory towards molecular dynamics, which is a different type of molecular modeling, we can look at things like solvent screening, processes like precipitation and seeding, nanoparticles. Can we model those things in a reasonable scale with the same level of predictability that we can currently do with our DFT models? And then specifically in terms of pharma challenges, we're looking at, again, not moving away, but as well as working on our small molecular crystals, moving towards our larger molecules, our peptides, our viruses, and that kind of scale, and then expanding the manufacturing processes that we can predict the molecular interactions and behaviors of using these types of models. So if there are any theorists in the room, I've kept it free of quantum mechanics for today. If you like quantum mechanics and density functional theory, we have an SSPC review paper that came out last year from the modeling team if you want to nerd out and read that, just to highlight the applicability of our models to various fields and the kind of the hardcore quantum mechanics that goes into these kinds of things. So I'd like to thank all my collaborators, all of the experimentalists in SSPC who work with us every single day. This is a very small snapshot of the projects that we do in SSPC, my current research group, and all of our collaborators inside and outside of the centre, and you for listening. Thank you.